Currently, people are paid depending on what services they receive from Medicare. So in other words, you get paid if a patient goes into hospital. You don't get paid if you keep them out of hospital. CMS, I think very cleverly, has actually come up with an incentive to enable organizations to be paid for keeping patients out of acute care where it wasn't absolutely necessary. One of the very first things we do is a medication reconciliation. Now, we've set up this program in such a way that the hospitals that we're working with are having a pharmacist review those medications before they're discharged home. But our coach, when they go into the home, will actually say to the patient, show me what you're taking and how often, because that may differ from the sheet that you're given with the discharge instructions. And I cannot tell you how many times we have discovered in that process that things have been left off the discharge sheet, or things were added that shouldn't have been on there, that the patient had been taken prior to their first admission to the hospital. The whole purpose is to try and prevent an unnecessary rehospitalization. And we are confident, because this has been tested out in other parts of the country, and we're beginning to see early results ourselves. With this kind of follow-up, patients are not automatically reaching out to the emergency room at the first point of call when they're beginning to experience some symptoms. Just in this area alone, if we achieve our targets over a 3-year period, you're talking of savings of millions of dollars. So if that's just in this one district of Brooklyn with 2 hospitals, imagine if it's across the country.